whenever you put your stethoscope into the pulmonary area, there are 4 areas in the examination. One of the areas is pulmonary valve area. When you put your steth, you find a single S2 and then ejection systolic murmur. Once that is there, it's nothing else, it has to be a tetralogy of Fallot. And the child will be blue, and the child also will develop something called as clubbing in their fingers, both their toes and fingers. You will have clubbing. That means there will be tip of the fingers will be bulged because of deoxygenation, because of blood supply is hypoxemia. What happens, there is arteriovenous malformation at the periphery, you will also get clubbing. And cyanosis we know because there is hypoxemia, the child is blue, is not getting fully oxygenated, blood is not getting oxygenated. So you be blue, and clinically you can diagnose by single S2 and ejection systolic murmur. And the most definitive diagnosis is you do echocardiography, where you find a large VST and there is overriding of aorta and a valvular or infundibular pulmonary artery stenosis. And more advanced stage, you have a doubtful of anything, you can also do something called as right heart catheterization. When you do a right heart catheterization, you need to be very specific to see there is something called as Magoon's ratio. That is the ratio is used for operability, whether this child will become all right once we operate. That means complete repair is done, whether the child can become all right. How do we do this Magoon's ratio? We calculate the pulmonary arteries at the branching level, the diameter of the pulmonary artery at the branching level, and divide it with the descending aorta at the diaphragmatic level. The Magoon's ratio should be at least more than 1.8. Once if the Magoon's ratio is more than 1.8, that means after you do the surgery, the child will become all right. If it is less than 1.8, then there is a lot of risk is there, and borderline the outcome of the surgery may not be that great. So always you should expect the Magoon's ratio should be more than 1.8.